It is 12:14. You are listening to the Mid-Morning Talk on Salam Media with me, Mari Makonda. It's time for our discussion. Amid critical shortage of nurses and doctors in South Africa, healthcare workers are increasingly looking at their options overseas. A survey conducted by the South African Medical Association showed that as many as 38% of its members plan to emigrate from South Africa due to the planned induction of the NHI. Joining me to unpack this discussion is the Secretary General for the Democratic Nursing Organization of South Africa, Kwena, Manamela, as well as Dr. Mahlane Phalane, the South African Medical Association Trade Union Founding Secretary General. Kwena, Manamela, a good day to you, and thank you for joining me.
Good afternoon, Mariam, and thanks for inviting me.
And a good day to you, Dr. Palani.
Good day, and thanks for the invitation.
Right. So if you ask anyone who has been to a public healthcare facilities, whether it is a clinic or a hospital, you have to wait quite a while to be assisted. And many of the times it's due to a shortage of staff. Now, why are nurses and doctors leaving South Africa and looking for opportunities overseas? Let me start with you, Dr. Palani, since, well, you are first of all a doctor.
Yeah, no, thanks very much. This is a very complex discussion, but I'll try to simplify it and shorten it as much as possible. There's a plethora of reasons and factors that will cause, one, the issue of shortage, two, the issue of why would health professionals, doctors and nurses in particular, and all the other health professionals in general, to either leave the public sector to go to private or even immigrate. One of those issues would be there are too many challenges in the healthcare system. Those challenges come with the opportunity for us to solve them and create a good, high quality and sustainable healthcare system. Maybe just to jog your memory, because people think that the private healthcare sector in South Africa has been here in existence since time immemorial. It hasn't. It has come recently. In the past, we only had one healthcare system. That's why if you look at some of the greatest health advancement and procedures, such as one, the first human heart transplant was done in a public hospital in Grooteskies. If you remember the separation of the Siamese twins, the conjoined twins, by Professor Mokoko, the Banda twins and Polimponyana as well, they were both respectively done in public hospitals. I'm just illustrating to you that the public healthcare system used to work, and it used to be one of the best. The creme de la creme was in the public healthcare system. Lastly, on that point, in South Africa, we don't have a private medical school. All the skills that you see, especially in medicine, and even specialists, they would have trained in a public healthcare institution, which means there is high quality in terms of skills and expertise. So where are the challenges? So the challenges will come in terms of infrastructure, remuneration, working conditions, workload, lack of resources. Those will be generally the issues around the economy in the country, crime, lack of safety and security, because some of our hospitals as healthcare professionals, we are seen as soft targets by criminals. They steal our belongings. In worst case scenarios, you saw recently a doctor was shot dead in his practice. So those are some of the pushing factors. Thank you.
All right, and on your side, Mr. Manamela, as the Secretary General of the Democratic Nursing Organization of South Africa, why are South Africa's medical staff looking for opportunities elsewhere?
Yeah, no, thanks very much. As Dr. Palani has already indicated, there are a number of things. Although from my side, I haven't seen the data from the South African Medical Association, but I would know from previously what happened in the country. Indeed, there is a number of things that might make health professionals leave the country. I would concentrate mainly on the issue of the nurses. I know several years ago, because of what you are talking about taking place in South Africa, a brain drain in the country. And we must also remember that to train one nurse cost the public sector or the state a whole lot of money. So losing one, it means the state has lost a lot of money, both from the training point of view and secondly, from the service delivery point of view. But just to try and come closer to what you're saying, South Africa, from the nursing side and from the statutory point side of view and government, we don't have good data that will guide us precisely what is it that we are faced with. Because you may find that in the health sector, there is a data that is slightly different from the statutory, that is slightly different from the association of each ourselves. So I think where we are, we're still struggling. There was the World Nursing report that was released that showed that we still, especially in Africa, we're still struggling in the collection of the proper data that will be able to really guide us. But let me come to the issue that in previous years, yes, there was a brain drain of nurses because international agencies and countries that were well off, that were promising nurses heaven and earth or green pastures, they were able to lure them into their own countries to add, maybe just to relax, also to relax the traveling requirements and so on and so on. That was seen previously, and there was a model that South Africa came up with, the occupational specific dispensation, that was trying to bring back the nurses that have left the country for greener pastures. And I think that model worked as a vehicle to bring back around 12,000 nurses back to the country. But it was not a tool that was supposed to be there permanently. That was if government really thought that that model or that tool was going to retain them permanently in the country. I think they were wrong, because the tool, yes, it was able to bring them back to the country for that moment. But once it was used, then nurses and other health professionals were faced with the reality. When you are employed, you were not there when the tool was applied. You may find yourself different from the rest of the others. You have to start somewhere as per appointment measure. So I think those were the issues now where we are now, that we are almost back to square one, where we'll have to convince the nurses why they should, and the other healthcare workers, why they should remain in the country. Yeah, we may come up with several things to say, the country have trained you, you have to be patriotic to the country. But if the conditions of service have suddenly changed and are no longer unbearable, because the employer must make the environment conducive for these workers to be able to stay in the country. So then they will choose where better will they apply their skills. And most of them you find them flying to European countries. Mostly they don't go to African countries, because I think the recruitment that is done by European countries. Might be because there are better packages than what we can offer here as a country, but I think that is one of them. And the other things might be that they are better equipped, there is better infrastructure where they are going, and so on and so on. There is a list of all the other things that make one comfortable to practice your skill. I think that is a number of those that you can list. And other things is that you may find that they are well staffed where they are. There are norms where they are, and then those norms are followed.
All right. Now, speaking about nurses and speaking for nurses, what are some of the grievances that have been raised by the medical staff? Can you please continue with that, Mr. Manamela?
Yeah, most of the things that they have raised is COVID-19 has exposed a number of gaps in the system itself. And I think
Mm-hmm.
some of which we were not aware. The situation is somehow worse now because now the nurses are also aware which gaps are there in the system. They were all the time covered. And during the COVID-19 nurses worked tirelessly. They were working abnormal hours, trying to rescue, trying to service the people, trying to face something that nobody else knew. It was new for all of us, but they were able to leave their families, risking their families and so on, and go and face the COVID, the virus itself. But what they have realized during the process is that there was lack of recognition or
Mm-hmm.
a token from the government, for that matter, to say thank you very much for the work done. We are aware that you are short-staffed. We are aware of the workload that is on your shoulders, on your head, but that didn't come through. Instead, you in 2020. The situation worsened when the public sector, because we're talking for private and public. The private sector might have not experienced that, but they might copy that, what the public sector is doing. The public sector was, they were not able to honor the last leg of the agreement that was there in 2020. So I think that is one of the things that really angered the nurses to say, we are not recognized for the work that we are doing.
Mm-hmm.
It's just
Right.
one of the things. But to add, it's the issue of the infrastructure itself that is dilapidated. Dr. Patlana was talking about criminality that is creeping in these institutions. Criminals are now targeting the clinics and the health centers, stealing from these workers, and in some cases they kill them.
Wow.
Yeah.
All right, Dr. Palani, earlier on you mentioned that the healthcare system used to work. So what happened? Why is it no longer working optimally like the way it used to before? Dr. Palani, are you still with us? All right. Let me continue with you, Mr. Manamela. Now, what is going to be the future of our healthcare system if we continue to lose more medical staff?
We have proposed, we said if government can't review the OSD, then let the government come up with another dispensation that will be enticing to the entire health professionals. We know that the doctors had theirs, the teachers had theirs, the nurses had theirs, and the one for the nurses was the first one. And I think because it was the first one, I would assume that it was not well done because I think it was it was sort of piloting it, and they piloted it with the nurses, and then it was better maybe when it went to the teachers, I would assume, and it was even better maybe when it was applied to the doctors. But because it started with the nurses, we believe that it was not well implemented, because where we are sitting today, we're still sitting with the aftermath of how it was implemented. It was in many instances it was not well implemented, and it left a whole lot of others out. Uh, Maybe it was because of its intention that it must attract nurses and other health workers to specific areas, preferably your primary health care settings, and then moving people away from the hospitals. But the level 1 hospitals and the level 2 hospitals, that is where most of our members didn't benefit in terms of the OST. So that is why we're saying either it's reviewed or a new dispensation is being put in place so that it can be able to retain the nurses within the country.
Mm-hmm. All right, so I'd like to bring Dr. Palani in. Doctor, earlier on you mentioned that the systems used to work. The government or public healthcare facilities were, they were the places to go. You could go there and come out without having to wait in long queues or not get treated or seen the very same day, uh, like what we're seeing at the moment. So what happened? Why are we finding ourselves in such a situation whereby the systems are no longer working the way they used to?
I think it's a simple concept. I respectfully submit that South Africa doesn't necessarily have um, resource problem or funding problem. Our greatest problem is leadership and management problem, in decision in particular, because you can see it in other various aspects, whether it's in our energy sector. We saw it with teaching at some point. We had over saturation with teachers, then we had a lacuna, then we had shortage of teachers. So is this issue of lack of management and planning for things, for instance, when you have a population growth, and when we have what the euphemism of quadruple burden of diseases, the HIV, non-communicable diseases, that will be your lifestyle diseases, when you have trauma, when you have all those uh, uh, epidemiological evidence that we have, and we have all the information that we have. If you look at, for instance, even from the apartheid government, the apartheid government in the 40s started with the issue of universal health coverage. In the 40s, they already had a commission that recommended what needed to be done. You read all the policy documents, even from the ANC, whether the Freedom Charter, you come down, they all have got the roadmap and the blueprint of what needs to be done. Recently, you look at the what former Minister Motsoaledi was talking about, the 10-point plan. If you look at the 10-point plan that the Department of Health had to sort out healthcare in the country, the only focus is on the NHI, which becomes an emotive and a political issue and an economic issue. They miss on sorting out all those other issues. If we were to sort out all the 9 points in the 10-point plan, the system itself will just improve. We will not even, for instance, look at how former Minister Nkosazana Dlamini Zuma turned Home Affairs from horror affairs into proper Home Affairs. Now you go there, apply for your passport. Within 7 days, you get it. Things used to get lost. It will take years and months for you to get those things. There are simple things that we need to do in health to sort out our healthcare system. And COVID, as our colleague Mr. Manamela has mentioned it has made it acutely clear for all of us. Even when we are sitting in this discussion, we may think that because we've got medical aid, we are protected. We are not. COVID-19 has exposed that, where the private healthcare sector, which is estimated to cater for 16% of the population, could not cope. Literally, people with their means, money or medical aid, some of them could not be taken care of in the private healthcare sector because it just could not cope with that pressure. So it is therefore in our best interest to make sure that the public healthcare system and the healthcare system in general in the country works. What doesn't make sense when I'm telling you that our problem is not resource problem, it's management problem. Let's show you an example. You will have problem with ambulance where people will wait for 4 hours, 6 hours. A pregnant woman waiting for 4-6 hours. It does not make sense, because you may find that this person is not necessarily that we don't have ambulance. We have ambulances in the system, but we don't know how to mobilize all of them. You may find that, especially if you drive down the road, you will see a lot of private ambulances idling there, not having work. But here, 2 minutes down the road, somebody is dying because they are waiting for a government hospital, a government ambulance, which is not available. That's what I mean. If we were to tap into these resources, our healthcare system ought to improve. If we were to care a bit.
Definitely. All right. Sorry to cut you off there, Dr. Palani. We need to take a quick break and we will continue thereafter. Please stay with us.
The agency aims to provide 650 children with education that will change the trajectory of their lives and their families' lives. Fulfill your intention by fulfilling their dreams. Donate 16,000 Rand per child or any amount. Go to africamuslimsagency.co.za or call us on 011 834 8685. Africa Muslims Agency, empowering, educating, inspiring.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying, or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
Give charity without delay, for it stands in the way of calamities. For child-headed households in Bloemendal in the Eastern Cape, the daily diet consists of white bread and a carton of cheap juice or sugar water, known locally as the poppy water diet. Make a difference to that one child or family. The Al-Fida Foundation has over the past 13 years worked on the ground and gathered the largest database in the Eastern Cape region of Muslim Zakah recipients. Phone our offices at 041 484 1288 or visit our website at www.alfida.co.za. The Al-Fida Foundation, your social investment partner in the Eastern Cape.
It's a new beginning. It's a new era. Salam Media, humanitarian journalism.
For a long time, we've lived in a centralized world where institutions held the all-important data and confirmed all transactions. Those times are over. Welcome to Libertas Group, a blockchain developing company boasting an ecosystem that continually redefines the way we do business. Our blockchain is decentralized, making it immune to hacking or alteration, putting the power back in your hands with no middleman so you can focus on the growth of your business. Libertas, the simplest investment choice you'll make.
Did you know that you can get the latest humanitarian news and updates from the Al-Imdad Foundation by following us on Facebook, Twitter, Instagram, and YouTube? You can also receive our flash updates via WhatsApp by adding 082 591 6430 as a contact and sending us a WhatsApp message with your name. That's 082 591 6430. Visit alimdad.com or call 0861 786 243 for more information.
There are an estimate of 153 million orphans worldwide. Change their lives by donating towards our Orphan Kind program. For 750 Rand per month, you can be the reason an orphan smiles. Go on, be orphan kind. Visit www.pennyappeal.org.za or call 031 1100 573 to find out how you can help save these children's lives. Penny Appeal. Small change, big difference.
Listen to something fresh. Listen to Salam Media, your humanitarian broadcaster.
12:37, you are listening to the Mid-Morning Talk on Salam Media, and we are discussing why healthcare workers are leaving the country to look for better opportunities overseas. According to the City Press interviews, local nurses are unhappy with their earning potential and feel that there is no room to further their education in the country. Many said that they were unable to afford both a house and a car, and said they were working with limited resources at hospitals and clinics. And still with me are my guests from the South African Medical Association Trade Union, founding secretary Dr. Mahlane Phalane, as well as the Secretary General for the Democratic Nursing Organization of South Africa, Kwena Manamela. Mr. Kwena, it seems like we have lost the doctor again, but that's fine. Now, according to what I have just read here, Mr. Manamela, many of the nurses said that there's no room for education in the country, that they cannot further their education. So obviously, this is another it's a few steps backwards for them, because now they want to further their education, but they cannot do that. So what can we do about this situation?
Yeah, I think the issue that you have just mentioned is a crisis in itself, and I think it needs to be addressed very, very quickly. Remember, the curriculum for nurse education has been changed from what previously used to be to where it is now, where it is now offered at higher education level. So the challenge came there because previously it was offered by the colleges that were linked to hospitals that were managed by the Department of Health and so on. But now, since it has moved to higher education and the curriculum has changed, the numbers, the nurses are correct to say the prospects of them training are limited every day, because now the numbers are determined by the higher education institutions. And the numbers have really went down, they're limited, because per institution you find that is 15 intake per the intake period, whereas previously you'll have more than 100, or a college training more than 300 nurses at a time. But now if you have 15 at this institution, 10 at that 15, in future it's going to create a very, very serious shortage. But worse is that once you have done your basic degree or your basic diploma, you want to further your studies by doing postgrads, diplomas, and so on and so on. So that opportunity is no longer there, it's closed, especially for those that have done diploma at a college level. They can now progress because the diploma is at level 6, and the postgraduate diplomas that I'm talking about are offered at level 8. And how do you bridge from level 6 to level 7 without going through a bridging program? And if there is no bridging program, that is why the NS are saying now the prospects of them training in the near future is very much limited, because they have to bridge level 7 in order to do a post-grad diploma that is offered at level 8 at the universities and universities of technology. So I think that is the greatest thing that we have, that maybe other mechanisms have to be put in place, like your recognition of prior learning and so on and so on. So in the absence of recognition or a bridging program that will bridge them from there, you're going to sit with a very big problem that in the near future, you might not have nurses that have specialized. That have specialized. You find that it's only one institution that is offering speciality in psychiatry. And we have how many psychiatric institutions in the country? Because as far as I'm concerned, it's offered only in the Western Cape. How many from all over the country are going to make it to the Western Cape to do it there? And not to mention other post-basic diplomas that are critical. We have seen during the COVID-19 that you need nurses that are trained in ICU, high care, and so on and so on. So if those are not forthcoming, we are going to face a very big crisis going forward. Not to mention the advanced midwives that are delivering babies on a daily basis. So that is a crisis that we have in education that still needs to be sorted out. And you remember that if you change the curriculum, you change everything, and you shift from public now to not to say public, but you shift education where it was to higher education. Now it means you have to accredit every institution that says it will be able to offer nurse education. So it's not all the institutions that were offering before that will be accredited. Maybe because I don't want to say they were not meeting the requirements previously, but it's difficult for them to be accredited. So fewer and fewer and fewer institutions that are going to offer nurse education in the country. There are very few as we speak.
Right.
Yes.
So we do have
That is the
Dr.
part of it. Yes.
All right. We do have Dr. Palani on the line right now. Doctor, with the high unemployment rate that we're currently facing as a country, but also a shortage of healthcare workers, is South Africa willing to take in foreign medical staff just as the European countries are willing to take South Africans? Dr. Palani? All right. I think
I
Dr.
can
Palani is
hear you.
having
Can you
some.
hear me?
All right. Yes, I can hear
Can you
you.
hear me?
Please continue.
Yeah. No, I was saying that will be very odd for us to rely on foreign workforce because we are already struggling to absorb our own local health professionals. Even those who might be South Africans who have trained outside the country, we are struggling to absorb those. Maybe in certain scarce areas, like scarce skilled areas, it might be necessary to consider getting foreign workers. But as we speak now, let us first absorb everyone, every South African who is qualified and looking for a job.
Now, why aren't newly trained and qualified nurses hired? Like, won't this ease the strain of the shortage that we're currently facing, Doctor?
Look, the issue is doctors, nurses, and other healthcare professionals work together. For instance, you can have the best surgeon and anesthetist, but if you don't have theater nurses, that will not work. A lot of things like it was already eloquently said, the critical care trained or ICU trained nurses, we need those nurses. In rural areas, in clinics, primary health care, they are the ones who are the backbone of the healthcare system, carrying it on their shoulders. So we need those nurses, and we even need much more specialty nurses in midwifery and advanced midwifery, in child care, because we have set high global and national standards to do whether it's children under care, maternal mortality. For us to achieve those things, unfortunately, we need hands. You need human beings, you need nurses, you need doctors, you need these professionals to achieve that. Healthcare is a labor-intensive service. There is no any other way. You can try to automate. You can automate on the support systems, whether it's medical records or all the other things. But the actual healthcare service, you will still require warm bodies to get the work done. So we don't have a choice. We need to train enough. We need to absorb those who are here. It's going to be a costly exercise, but it's a necessary exercise to keep us healthy and alive.
All right, and back to Mr. Manamela. According to salary tracking websites such as Payscale, Indeed, and Talent.com, the average salary for a nurse in South Africa within a broad range of 250,000 to 360,000 per year, with some salaries as low as 150,000 a year. Obviously, some of those numbers are not inviting or motivating enough, but some nurses are willing to take that. And according to the South African Nursing Council in 2020, there was one nurse for every 213 patients. I'm afraid to learn what the numbers are currently sitting at right now, because I mean, you do find that a person will go to one hospital and then not get helped, and then go to another hospital and then still not get helped because of the shortage of nurses available. So what do we need to do in this case? Do we need to increase the salaries of the nurses to motivate them to stay? Please unmute.
Yeah, obviously it has shown that what you have just said is one of the motivating factors, although it might not be the only, but it is one of those things that will motivate. Like we say, there was a really brain drain, because if the country is unable to do that, then somebody else will do that somewhere else. And obviously it's the European countries that will lay our nurses with lucrative packages. And we know that it's not nice to work away from your own country. You have to have your family and everybody else supporting you nearby. But it's not very palatable to work outside of your own country. But yeah, it's one of those things that needs to happen. I think that is what is happening, what I was talking about, the new curriculum now. is in a way trying to address what you are talking about. Because remember, legacy-wise, it is that we had three categories of nurses. You'll have your assistant nurses, you'll have your staff nurses. I'm talking the names that you are used to, and you'll have your, what do you call, your professional nurses. So those are the main three categories of nurses. Maybe the salaries that you saw displayed there is along those lines. And the education that we say, we're moving from the legacy qualifications into the new type of qualifications, wherein we hope, after what the initiative that has been done to try to bring the nursing education back to the mainstream, is to try also to bring the salaries of the nurses back to the mainstream, so that we don't see nurses who can't afford a house, who can't afford a car, and so on. Hopefully, after there's a new, a fully transition to the higher education and training, and the issue of the framework, your, what do you call that, NQF, has been addressed and all that, then we hope that we'll go back to the table and we'll like to see the changes in the salaries of nurses. Because previously there were rumors that nurses not a profession and so on. We tried to consult the minister to say it is an insult to the profession, because nurses know that nursing is a profession. And if it is not categorized in the Department of Labor as one of the professions, it will be an insult to the profession of nursing. So we hope those things will no longer surface. They will be corrected, and the salaries that you're talking about that are an insult to them will be corrected and aligned to the mainstream salaries of professionals. Those who have done 3-year diploma will be remunerated like any other 3-year diploma in the country. Those who have done a degree, a 4-year degree, will be remunerated like any other 4-year degree in the country. So that is what we're looking for.
All right. And Dr. Palani, on your side, what can we do to avert the situation, to avoid more staff, for more health workers from leaving the country?
Best working condition. It's a patient condition. So we don't work separately. Where we're working on this, we improve the working conditions of doctors. Inadvertently, we are saying improve the conditions that patients experience healthcare system, in particular in public. So there are things that must be sorted. Sort out the healthcare financing so that there is adequate budget to achieve the targets that we have set for ourselves. Make sure that we have got a proper healthcare workforce or human resource planning and implemented. For example, the transformation in the nursing training should meet the needs of the healthcare in South Africa, so that we've got a Afrocentric curriculum that responds to the needs that we have in this country. One of the most important things that we need to do as well, let's sort out the issue of leadership and management, because that's where we're scoring a lot of own goals, so that we don't only prioritize our schedule, but we also schedule our priorities. We know what needs to be done, what will be sorted. For example, I'm saying if we don't have a panacea to solve all the problems in the healthcare system, but there are certain things that are so critical such that they must be non-negotiable. Sort out the maternity or maternal healthcare system. Sort out the emergency healthcare system. Sort out the critical care or ICU. So those are the areas that you know the golden hour means the difference between life and death. You sort out those things. The other things we could have time. If somebody has got a certain condition that is slow to react, we could have time to correct that. But these emergencies that are killing our people, like trauma and violence, we need to deal with those things, because we won't get a second chance to bring back that person from death back to life. The other issues is simple things like the issue of medication and drugs and all these things. Let's make sure we've got adequate supply of those things. We should manage well. For instance, there should not be under such huge demand for operations in healthcare, where you find that theater operations have been cancelled or postponed because there is no linen in theater. Those kind of things are inexcusable. They should never even see a light of day in our healthcare system. Also, let's take care of healthcare workers so that they can take care of the nation. If we don't take care of the healthcare the force, that's our problem, because you can't go to war with a sick or unhappy or angry army. We need to make sure that our healthcare workers are happy, are satisfied, they are motivated, so that they can serve our country. Remember, last there is no economy, or there's no wealth without health. Our health is the priority. If you are sick or dead, you cannot build an economy. We should get our priorities right. COVID-19 has showed us that a broken healthcare system will collapse the entire economy, pose a risk of wiping away the entire nation or a generation. So we must sort out our healthcare system. Thank you.
Thank you. And well, we have seen because of the way our healthcare system is, we are seeing an increase in medical insurance, and more people opting to go the private route so that they can get assisted. And unfortunately, that is only going to collapse the public healthcare even more. I would like to thank both of you for taking the time out to join me here today for this discussion, and have a wonderful day ahead. Thank you. And that was Kwena Manamela, the Secretary General for Democratic Nursing Organization of South Africa, DENOSA, and Dr. Mahlane Phalane, the South African Medical Association Trade Union Founding Secretary General, taking us through this discussion of why are health workers leaving South Africa to look for opportunities overseas, and overseas recruiters coming to South Africa to make the process easier. You can share your comments with us in the comment section, or send them to us on WhatsApp on 061 766 0355. What are your thoughts on this issue? We are currently at a shortage of healthcare workers, especially nurses. We have nurses and doctors leaving public and going to private, and also going to overseas, etc. Some trying to open their own practices, etc. But it is providing a huge I lost my train of thought there, but it's providing a huge strain on the public health care at the moment. You'll find that a person who lives in an area of Johannesburg going to another area, leaving their clinic or hospital behind to go and seek help on the other side, because they think that they're going to get better help on that side. But it's like, it's just a circle. It's just a chain. We need to fix the one link up there so that we can have a stronger chain. So much that needs to be done to tackle this problem that we're currently facing. And earlier on, Dr. Palani mentioned that leadership and management is a problem. And we all know that. We all see it. We're not even going to get into that discussion. It is 12:57. You are listening to the Mid-Morning Talk on Salam Media. We'll be right back shortly.